the money that has been transferred into the Social Security funds now is supposed to come back to us later in our retirement life. But for a while now, experts and politicians alike have been warning that the chances of that actually happening are not looking so good.
If in fact he continues to withhold his plan to withhold the tax on Social Security will be bankrupt by 2023 with no way to make up for it.
Social Security faces a big mismatch between revenue that it's scheduled to take in and the benefit that is scheduled to pay out. Currently in the year 2020, the department is paying more in benefit than they're receiving in revenue.
More and more young clients are asking whether or not Social Security is going to be there for them. And we don't know the answer to that question.
Since 2010, Social Security's cash flow has been negative ever since, which is just a fancy way of saying that the agency isn't collecting enough money through taxes to cover what it's paying out. However, there was still this huge trust fund behind Social Security. So, they started tapping out the interest on that fund. But here's the thing. Starting in the year 2021, they will have to dip into that trust fund itself to cover those benefit payments. And even the pool of cash has an expiration date too. Trustee of the fund expected by 2025 that it won't be enough to cover full benefit payments. To make the matter worse, COVID-19 has speed up the date of this forecasted situation to happen faster than ever before, which has some retirees seriously worry about their future. But the expert thinks that the lawmaker will not, under any circumstances, let the system go bust. Which begs to the question, what went so brutally for the 85-year-old program? And will it actually be there when you're ready to retire? Let's talk about how does the Social Security works in simple English. The Social Security program is a program that has been taken care by the government under the specific name of the Social Security Department, which has its known true purpose of wanting the people within the society to help each other. And that's where it got its name from, Social Security. The way Social Security functions is simply to average the happiness and the difficulties of people within the society and find a balance. Meaning, for those who are in a poor economic condition, they will be assisted by the funds from the Social Security coverages. Conversely, for those who are still in a good economic shape, he or she has the duties to work and pay a portion of their salaries into the Social Security accounts. Referring back to the beginning of this video, it's
6.2% of my pay stub, which is then matched by my employer.
There are many types of Social Security funds, depending on each country's law and regulation. But the majority of Social Security funds are the component of two main parties. A portion of money from employees that have been transferred into the Social Security funds, and another same portion of money that has been paid by their employers. Later, if there is a person in the society that needs help, let's say a woman needs the money to do her parturition, a process of giving birth to a child, then she can get the money directly from Social Security funds.
According to the World Bank and International Labour Organization, universal social protection represents the set of policies designed to guarantee income security and protect people throughout their lives against poverty. Also, it ensures that anyone who needs social protection can access to it anytime, including child benefits, people of working age in case of disability, etc. Social protection is aiming to reduce poverty and boost shared prosperity. Why is universal social protection important? There are many aspects where universal social protection is involved in. To begin with, It promotes employment as it plays an important role in creating access to productive employment and decent work for all through health insurance and family support policies. Furthermore, it supports positive education outcomes with a supply of free tuition and materials or cash transfers, which leads to higher enrollment rates. Lastly, it contributes to sustainable economic growth by raising labor productivity and help people to find decent jobs. Now, nearly 30 low and middle income countries have universal or at least nearly universal social protection programs. However, there are challenges. For instance, the willingness and capability of governments to invest in the expansion of universal social protection for everyone. Therefore, there are still large gaps and inadequate benefits in many countries. Now, let's talk about trust funds. All Social Security payroll taxes and other sources of income are deposited into Social Security trust funds, and social benefits are paid from them. So, these trust funds simply can be used to pay benefits and program administrative costs. In the United States, income to the trust fund must be invested daily in securities guaranteed as to both principal and interest by the federal government. U.S. Treasury securities are considered the safest kind of asset to back any claim. However, since 2010, the payroll tax hasn't been enough to cover benefits payments for the baby boomer generation, who started to retire in 2016. The deficit of $75 billion was covered by the interest earned on the trust fund in 2016 and almost $80.8 billion in 2019. Moreover, people are living longer and people in baby boomer generation are retiring. Hence, Social Security will have to use the trust fund itself to help pay the benefits. Predictions from experts is that the reserves could run out by 2035. So the Social Security may only be able to pay 79% of promised benefits. Therefore, it is likely that the government will intervene to solve the problem before the agency has to cut benefits.
People aged 60 years expect to live additional 22 years, according to UN report. By the end of this decade, the number of people aged 60 years and older will be 34% higher, increasing from 1 billion in 2019 to 1.4 billion. By 2050, the global population of older people will have more than doubled to 2.1 billion. In 2020, for the first time in history, people aged 60 years or over will outnumber children under the age of 5. Ability to live longer is congratulable for the progress in civilization of mankind. Improvement in overall body of knowledge, and specifically medical science, have been adding more years per capita for a person to live, but the coin doesn't have only one side. Living longer doesn't bring only bliss, but also complex problems to solve. Longer life doesn't mean a better life. Passive lifestyle that accelerates medical problems. Loneliness from social isolation can cause more harm than good. That is why many countries are working hard on coming up with a policy to prepare for the rapidity and the magnitudes of the demographic aging. And healthy aging is one of the most informative and influential global collaboration that aim at coping with the problem that associated with aging society. In this presentation, I'm going to talk about aging society versus healthy aging, unequal distribution of healthy aging, and disaggregate socio-economic status, and the 4 areas of action that government can consider implementing to integrate healthy aging into the policies. Adding life to years, the extra year of life in good health. People who experience these extra years of life in good health and continue to participate and be an integral part of family and communities will strengthen societies. However, if the added years are dominated by poor health, social isolation, or dependency on care, the implications for older people and for the society are much more negative. Healthy aging is developing and maintaining the functioning abilities that enable well-being in older age. Functional abilities is determined by the intrinsic capacity of an individual. For example, the combination of all the individual's mental and physical capacities and the environment in which he or she lives, which is understood in the broader sense and including physical, social, and policy environments and the interaction among them. Even though healthy aging seems like a good thing, but still there is a problem that needs to be addressed. Healthy aging is closely linked to the social and economic inequity, and here's why. Disadvantage in health, education, employment, and the earnings start early, reinforce each other, and accumulate over the life course. Older people in poor health work less, earn less, and retire early. Gender, culture, and ethnicity are important moderators of inequity and result in wildly different trajectory of aging. What can we do to implement healthy aging? Here are the proposals made by the United Nations. First, change how we think, feel, and act toward age and aging. Second, ensure that community foster ability of older people. Third, deliver person-centered, integrated care and primary health service responsive to older people. And fourth, provide access to long-term care for older people who need it. Government can engage in helping us change how we think, feel, and act toward age and aging by reducing age-based discrimination. By first, using a legislative approach in response to age-based discrimination by imposing rules and regulations such as that of ethnicity discrimination or racial discrimination. Second, fostering intergenerational solidarity. What does it mean? It means that increase a cohesion between generations by adopting or supporting educational and intergenerational activities. How government can ensure that community will foster the ability of older people. Government can engage in creating a friendly environment by implementing policy, system, service, products, and technology to promote health and build and maintain physical and mental capacity throughout the life course, and enable people, even when they lose capacity, to continue doing things they value. The example of action that could be taken are stimulation of intergenerational dialogue, learning, and collaboration, extend options for household appliances for elderly in need of housing modification to suit their need, standardize safety of the accessibility of any flexibility, both public and private, development of assistive technologies, training program for financial and digital literacy to support income security and prevent elderly to fall into poverty, promote opportunity for lifelong learning, improve health literacy, self-management, and increasing overall physical activity and good nutrition, prevention and response to elderly abuse in communities. How government can help deliver person-centered integrated care and primary health service responsive to older people. Older people require non-discriminatory access to good quality essential health service that include prevention, promotion, curative, rehabilitative, palliative, and end-of-life care, safe, affordable, effective, good quality essential medicine and vaccine, dental care and dental health, and assistive technology, while ensuring that use of this service does not cause the user financial hardship. Many health systems set up to address individual acute health condition and rather than the condition of old age. By patient consent, government can collect, analyze, and report clinical data on intrinsic capacity and functional ability in national context, disaggregate by age, sex, and other intersection variables. Significant decline in physical and mental capacity can limit older people's ability to care for themselves and to participate in society. Access to rehabilitation, assistive technology, and supportive inclusive environment can improve the situation. However, many people reach a point in their life when they can no longer care for themselves without support and assistance. So, how government can help provide access to long-term care for older people who need it? Government can help by ensure regular frameworks and sustainable financial mechanisms for provision of long-term care, develop and share models for provision of community social care and support, including humanitarian emergency. Improving technology to improve functional ability and well-being of people who require long-term care. Structure financing model to support and sustain long-term care. Healthy aging give a promise for better life of elderly around the world, with perspective of retirement shifting from passive lifestyle to actively engage in the way of living that would improve overall quality of life of all people and yield a higher economic activity. But it is not neglectable that the complexity of these problems is still prevalent. There are still multiple problems and obstacles that need addressing. Collaboration on data gathering and extensive research is certainly a must. To realize healthy aging society, government and society around the world are required to collaborate and tackle this problem through dialectical and evidence-based approach by implementing protocol of addressing limitation, strategic approach to achieve milestone, and facilitate the execution of policy in the most efficient manner.